Hi, my name is Rachel Engelman, and my final paper topic is on female circumcision. My main points are on the perpetuation of gender inequality that this practice supports, the traditional and cultural values that are behind this practice, and the ethnocentrism that these cultures face for practicing female circumcision. I firstly talk about the medical risks that are associated, and then go on to talk about the traditional beliefs about the anatomy of a woman. I also talk about the gender inequality and how female circumcision represents how women are treated in the societies in which this is practiced. I also discuss the ethnocentric ideas about female circumcision in Western societies and how there is a push for the criminalization of female circumcision and how laws against female circumcision aren't enforced and they aren't really effective. The most compelling argument I found during my research was how women were stigmatized for being uncircumcised. If you aren't circumcised, it makes it difficult to get married, which in many of these countries means it would be difficult for you to have a good life. Women have little to no standing in these countries, making it that much more important for parents to circumcise their daughters. So if these parents want their children to have a good life, they must circumcise their daughters so that they have a chance to have that good life. So in order for female circumcision to no longer be practiced, it would uproot this entire society's way of thinking and values. I think that the most interesting thing I came across was a quote from a Sudanese woman who proudly stated that in some countries they only cut out the clitoris, but here we do it properly. We scrape our girls clean. If it is done properly, nothing is left other than a scar. Everything has to be cut away. You can tell she has a great deal of pride when it comes to the tradition of female circumcision, as well as her culture, and it shows how deeply embedded it is into their lives and how seriously this practice is taken. I learned that female circumcision is an issue because of the pain and gender inequality that is a result. I learned that there is no way Western cultures can end this practice at this point in time, and we should be trying to medicalize the practice with proper tools and anesthetic, making the process less painful and traumatic for young women. There are many types of female circumcision, and I'm talking about the main four. The first is clitorectomy, which is the partial or total removal of the clitoris. Excision is the removal of the clitoris and the labia minora or majora. Infibulation is the narrowing of the vaginal opening through the creation of a covering seal, and the seal is formed by cutting and repositioning the inner, outer, and outer labia, and in some procedures of infibulation, the clitoris is also removed. Other is categorized as any harmful procedures to the female genitalia for non-medical purposes, like pricking, piercing, scraping, and cauterizing. Here is a picture depicting a normal type 1, type 2, and type 3. Associated medical risks are quite great. Long-term risks include recurrent bladder and urinary tract infections, cysts, infertility, childbirth complications, and newborn deaths. HIV infection is probably the greatest risk because many women who circumcise these girls, they don't have medical tools and they don't have means to sterilize these tools. Many girls are done at a time or during the same day without washing or cleaning the utensils. So, as well as using dirty instruments on these girls, it makes it hard for them to have sex later in life without the risk of HIV infection. It causes lacerations to occur during sex because their genital organs are damaged and it doesn't allow proper secretions of fluids. So there is a lot of friction and it causes a higher rate of fluid exchange. Gender inequality is prevalent when it comes to female circumcision. It curtails sexuality, meaning that women often no longer enjoy sex, and that is essentially the goal of this procedure. Female circumcision is used to keep women pure until marriage, and then to keep them faithful once they are married. It is thought that women are weak and unable to control their libido, so female circumcision is the answer. Women must be circumcised in order to get married. This reasserts male dominance because women must do this in order to get a partner. And women who don't have a high standing in society, as I said before, must get married. This practice is allowing men to control women because in these societies, a woman truly needs a man in order to live and have a good life. Traditional thoughts support female circumcision, and one of these traditional thoughts is the clitoris hypertrophy, and this is the thought that the clitoris will continue to grow unless a woman is circumcised. It is believed that the clitoris will grow until she is unfertile, and if she is pregnant, it is believed that it will kill the baby. Women who are uncircumcised are ostracized and thought to be promiscuous because women cannot control their sexual urges and their libido. This is also a social norm. Girls who aren't circumcised, they're kind of put on the fringes and not accepted by men, obviously, and it's thought to bring dishonor to their family. So these ideas have connections to Kimmel because he has a story about a girl who was circumcised and about the traumatic experience that she had. He also talks about attempts to make it a more symbolic ritual, which would help a lot more than the Western ideas. And he warns that everyone who is trying to end this practice has to tread carefully because it's so deeply rooted in their society and their culture, and it is very important to them. So America is very ethnocentric towards this topic because we believe that, these traditional thoughts are foolish, how can they not know about the anatomy of a woman? So in these cultures where it is practiced, poverty is very rampant, and many women think that this occurs worldwide. Since many women believe that this is a worldwide practice, they have no other options, or they believe that they cannot say no. Many Western countries have tried to make female circumcision illegal in countries where it is practiced, and many of them do have laws against the practice of female circumcision. But they don't work because it's outsiders providing education whenever it's so deeply traditional and cultural that simply education isn't enough. And in the US, we practice male circumcision, and most people don't understand why we practice male circumcision. They just say yes because they think it's normal. They have a baby boy and the doctor asks if they would like to be circumcised. And many parents just say yes without thinking about, if there's actually a medical reason for this or if there's actually benefits besides aesthetics. And we also offer cosmetic surgeries as far as not only breast implants for women, but also like vaginal rejuvenation and reconstruction. So we also practice similar things, but because ours are medicalized and westernized, we believe that it's an okay thing to do. So this has been an overview of my research and my paper on female circumcision so far. I hope you guys enjoyed it. Thank you for watching.